and she takes care of the academic activities in YOSI as well. I'll invite her to introduce the session for all of us. She has formulated all the questions, so she's the best person to tell us about this session.
So thank you, Divakant. It's an honor, absolute honor to be moderating this session with Divakant. I'm happy that YOSI is one of the hosts for this, and thank you, Cake and Pie, for having this wonderful webinar. So I look forward to interacting with all of you. We have about 10 panelists from all over the world. So we decided to have this session about education, clinical training, and surgical training, along with some practice related questions for young ophthalmologists in specific. So we've been battling with this pandemic for the last year or so, and it has been hard on residents training, surgical training, and also young ophthalmologists just out of residency in the first 5 years of their practice. So we decided to formulate these questions uh, pertaining to this kind of scenario for young ophthalmologists, and I hope all the questions are going to cover most of our concerns. um, this panel discussion is going to be very interesting because we'll be having perspectives from young ophthalmologists from all over the world. So Divakant, back to you.
Yeah, great. So now I'll invite Dr. Digvijay Singh, who is the director of Noble Eye Care Hospital in Gurgaon, India. And he also heads the Department of Ophthalmology at Narayana Super Specialty Hospital. And more importantly, for this meeting, he is the president of the Young Ophthalmologist Society of India. To give us the opening remark, and then we'll proceed with the panel.
Thank you, Devakant. And it's indeed a pleasure to be having this session and to be able to interact with all of you. And I thank all the speakers for taking out their time from their busy schedules for participating in this YOSI session. We are really eagerly looking forward, to hearing all your opinions and thoughts about these questions. And this is something that has affected all of us in the young ophthalmologists age group, the residents, the fellows, and even in practice. So that's why we begin with what is more pertaining to us, which is the education portion, as well as the training portion. And yes, I declare this session open, and I look forward to interacting with everyone. And Devakant, over to you, and all the best.
Thank you so much, sir. So the first segment that we have is the education or the clinical aspect of the training. And a lot of us had to switch over to, initially there was a complete stoppage of the academics that was going on, and all of us picked up with the online platforms and started utilizing them. So we really need to understand how these webinars have affected academics, and and how whether it is difficult to concentrate for residents, whether it has become more interesting or easy or more accessible, and how can we overall enhance this teaching experience through the online platforms. For this, I want to have the opinions from a lot of our panelists today. And first, I would invite Dr. Honda. He is a vitreoretina surgeon at Changgung Memorial Hospital in Ningbo, Taiwan. And he's also the founding member of the Young Ophthalmologist Committee in the Taiwan Ophthalmic Society. So, Dr. Honda, over to you.
Okay, thank you, Diva Kent. It's a wonderful chance for me and for all of us to come here together online and discuss about all the educational changes during the COVID era. So for Taiwan, we just recently entered a semi-lockdown in the past 1 month. So it's a relatively short period compared to some other countries. But for the past 1 year, we have been adopting several measurements to cope with the possible lockdown scenario. So we have increased our online online meetings, morning meetings, and the feedbacks from the residents are quite positive. So for one thing is that they have less clinical duties, so they don't have to rush to the operation rooms or to rush to the clinics, so they can have a full experience on participating all the morning meetings. And it's good because we have some polling systems on the Zoom application. So we try to add more of this function into our morning meeting session. So to make sure that we can get instant feedback from the residents and to make sure that they're still awake during the whole process. Yeah, it's easy to fall asleep in the early meetings when maybe some of them are still in bed. So it's a very good function to have a poll from time to time on the morning meeting sessions. And it's also good that because previously, if you want to extend more discussion, you have to ask these questions privately after the morning meetings. But usually we don't have that much leisure time to do these discussions. But now, because they don't have much clinical cases, so I found that some more active residents, they will message me after the morning meetings and discuss further about the cases. So I think this is a very good practice for all the young residents, because in the past, maybe the consultants, they don't have much time to answer all these questions and discuss with you individually. But at this period, it's a good, if you're active, you can always get more from these senior doctors. So be active. I think that's still a very important key point under this COVID scenario. And another thing is that due to this pandemic, we have been cooperating with other hospitals in Malaysia and also in Japan. So we have a joint resident day. So in the past, we just hold a resident day from our domestic hospitals, but now we can collaborate with international hospitals. And say for Japan, we collaborate with the Tokyo Medical and Dental University, where Professor Ono Matsui is working now, and we have a great resident day with their residents. So it's more stressful for our residents, but more interesting and competitive. So they definitely learn a lot from these experiences. So I think these webinars are very good opportunities, despite we cannot meet in person, but we can always get more from these new technologies. So these are my some of my opinions. So now I open the discussion to the floor and back to our host. Thank you.
Wonderful inputs, Dr. Chou. And so polling is a wonderful feature that can be utilized to engage our residents. And really an interesting point where we can all different medical colleges and hospitals can collaborate and hold joint sessions. Wonderful inputs. Now I would invite our Vice President of the Young Ophthalmologists Society of India, Dr. Sonal Kalia, who is also a faculty at the SMS Medical College, Jaipur. Dr. Sonal, your inputs on this new way of teaching in this COVID era.
A very good afternoon to all of you. Thank you so much, Divakant, for the kind introduction, and thank you to Cake and Pie Media team for organizing this wonderful platform for a common discussion among young ophthalmologists of our age group who can, really bring forward these points about online teaching and other aspects that we are going to discuss today. So before coming here, I tried to discuss these points over with my residents and the other faculty, and I came to a conclusion that like every new technology that comes in, there are everything comes in with its own merits and demerits. So this whole thing has had a melange of responses, I should say. So like there are some residents who are very apprehensive to ask questions online because they fear that others will get to listen to their question and maybe that question is stupid, whereas in an offline platform they could always at the end of the class just follow the teacher and ask the question personally. So this was one response that I got, and then a response that I got was that they could always, have a demonstration of certain techniques when the teacher was right in front of them in the classroom, and the warmth, of course, cannot be replaced. But in the offline platform, they were also saying that when the panel of entire quorum of teachers is sitting right in front of you, so your attentiveness definitely goes up a volume when the head of the department and everybody is looking at you. And here at home, you're in a relaxed environment. You have the option of switching off your video and staying mute, and suddenly a call comes or something, and even if your screen is showing something on Facebook, your attention does get diverted for a second or so. Though being at home gives them a chance to also sometimes, be really stress free rather than the stressful formal environment that a class has. They were also trying to tell me that some of them who were having refractive errors and all, they developed a lot of screen fatigue after not just classes, but watching the number of webinars that have been cropping up. They also told me, and I also felt that a lot of residents used to message me that we have our COVID duties going on. See, the ophthalmology classes that are being organized and the webinars are the only way in which we are in contact with ophthalmology and really feeling like a resident of ophthalmology. Because in a government center, in most of the government centers in, I should say, North India, not just SMS Jaipur, all the residents have been utilized in the workforce for COVID and later for mucor also. So they have lost quite a lot of their time away from the wards of pure ophthalmology, I should say. So that was one way of being connected to the subject. And during all those classes, they could, in a way have some time away from the stress of COVID, I should say. But yes, overall, I think it's a mixed response that I could glean from the responses that I got in my department and from the teachers. Some people, like initially it was a peak of responses. It's like everything in life, there's a crescendo and then there's a loss of interest. So like online platforms, initially everybody wanted to learn about the technology and everyone was attentive, and later on the interest starts slowing down because they have this option of having all those meetings recorded and they can always watch it later. But that later, does it ever come? For me, I have tried to see some topics and then I'm like, I'm really interested. Oh yeah, but it's going to be recorded. I'll watch it later. And then that later doesn't come because there's some new webinar that comes in and, you are involved in it. But that's maybe just for me, and others are maybe much more, I should say, prompt and disciplined. Sometimes one does, fall off the wagon that way also. But then, yes, it's definitely a way in which we have all been able to continue ophthalmology training and teaching when residents are busy. And they do appreciate many aspects of it after the initial lag of the technology, in which some of the senior teachers were not able to understand how to really log into Zoom and all. After all those hurdles have been crossed, I think it's a very good way to continue our education. So thank you so much for this question, Apoorva and Divakant both.
Thank you so much, Dr. Sonal. And of course, as you have rightly pointed out, there are a lot of limitations and hassles that come with an online platform, and hopefully we'll be able to overcome them and soon. So next, may I invite?
Fantastic answer, Dr. Sonal.
So next, may I invite Dr. Chee. He is a consultant retina surgeon at the Singapore National Eye Center, and he also chairs the Singapore Society of Ophthalmology YO chapter. Over to you, Dr. Chee.
Hi, thank you, Divakant. Thanks for inviting me to this very interesting conversation. I agree with many of the points that Dr. Sonal and Dr. Hongda have already mentioned. And I think that we all have to agree that webinars have played a very critical role, especially in the initial parts of the pandemic, when I guess none of us could have met up face-to-face for any physical teaching sessions. And in a way, it has facilitated greater attendance in teaching sessions where in the past it might have been not so possible because of differences in clinical placement. But even though we have seen a sharp increase in attendance across the board for teaching sessions, I think participation levels have not increased and perhaps even decreased. And the reason for this, as the speakers have already mentioned, is the lack of a physical classroom environment. It makes it difficult because there's so many, there's a whole range of distractions working against a fully involved learning when you're not in a physical classroom. Like if you're listening in the car or when you're still on the bed. So there's a definite difference between that and a physical classroom. And it's also difficult to measure engagement levels because the teacher, I'm sure all of you would have experienced, if the videos are not on for most of the learners, you can't even see whether they are there. You're just talking to your computer. You're not sure whether people are listening, whether they are able to understand. You can't pick up any visual cues from the learners, and you can't calibrate the speed of your teaching to match their level of understanding. So I think as some of the speakers have mentioned, for webinars to be truly effective, there needs to be quite liberal use of learning checkpoints within the webinar, such as using quizzes, polls, multiple choice questions. You sprinkle them in the session to keep the learners engaged. And at the same time, you can assess the effectiveness of your teaching. Also, leaving enough time for Q&A is a good way for learners to catch up on points they may have missed or had difficulty understanding, and also allows learners who are not so maybe forthcoming to ask questions. They could type their questions in the Q&A box that many of these webinar platforms have, like Zoom. You have that as well. So I guess to make them more effective, the key is to encourage the learners to make use of these Q&A. You basically just type in the questions. You can ask questions, answer MCQs during the webinars to kind of enhance their learning experience. So this is how I feel that in the future, perhaps the new model of learning should be using some of these techniques. Yeah, thank you, Divakar.
Thank you so much. And yes, very rightly pointed out that it's really important to engage the audience and keep them engaged all throughout. And wonderful checkpoints that you've pointed out. So next, may I invite Dr. Ashraful, who is a phaco-refractive surgeon from Bangladesh, and he heads the Bangladesh Young Ophthalmologist Society. Dr. Ashraful.
Thank you, Dr. Devakant, and thank you, Young Ophthalmologists Society of India, for inviting me, and thank you, Media Mayse, for the wonderful Cake and Pie Expo. The thing is that for the new era, this is pandemic, we are scared, we cannot go out, but every situation has a new opportunity. What is that? In this pandemic taught us the webinar online classes. So that the classroom and the classroom teaching and the webinar teaching, these are not different. Rather than, I would like to say that the webinar teaching or online teaching is better, because what is that? Number one is that you can arrange lots of faculties, lots of teachers. Before the pandemic, we arranged the classes. So there are certain teachers, they had to come to the classroom and deliver the lectures. But now what is they doing? We are arranging different topics and lectures. Some foreign faculties and foreign specialists are joining and deliver their lecture, which is very much effective for the residents and the trainees. This is number one. And number two is that you can arrange it, not necessarily you have to arrange it by 9 a.m. to 5 p.m. in certain time. You can arrange it at night. So the other speaker would say that they have some little bit comfortability. The one different thing is that in webinar, you need to monitor about the students, about the resident, that the monitoring is for kindergarten and the playgroup students, not for us who are willing to learn. Because the webinar is such a thing that every resource is there. You need to pick what you need to take. That is the good part of the webinar. And I think that after the pandemic, webinar won't stop. It will continue. Maybe the hybrid, the new term, will continue. And another thing that the good part is that, yeah, we have little bit tech problem for the, talking that our generation, we are always the tech friendly. We have a little bit problem of the seniors, but this pandemic has the very good reason, and they've also taught the seniors to use the Zoom and other platform and other things. So they are also tech friendly also. So this is also the plus point. So my point is that I am very much agreed with the other speakers that this webinar and online teaching is very much effective, and this is obviously a little bit has more advantage than the classroom, but both we need to continue in future. Thank you.
Thank you, Dr. Ashraful. And yes, very true that a lot of us have connected because of this revolution, this Zoom revolution that we had. So it's a lot of us were able to collaborate and hold meetings. So it's a wonderful point that you made. Next, last but not the least, I have Dr. Mayse. She's a Jordanian board certified ophthalmologist, and she has also founded YOJO, that is the Young Ophthalmologist of Jordan. So Dr. Mayse, over to you.
Good morning, Divakant. Good morning, everybody from Amman. Thank you for the invitation. I think I agree with most of what everybody said about the webinars, because personally, I was skeptical when it first came out, because I don't really enjoy being in front of a screen for a long time. But when I just realized that it's a great opportunity for me, even as an ophthalmologist and as the residents as well, to get the experience from worldwide residents or even world-renowned ophthalmologists and be in their master classes. I believe webinars brought the world together in a way that we wouldn't have seen if it weren't for the pandemic. Another thing that we did in Jordan is that we tried to, gather the experiences of ophthalmologists from different institutions, where there is an institution where we don't have maybe an oculoplastic surgeon. We try to make that oculoplastic surgeon give masterclass for all the residents, for board reviews as well. That wasn't there before. So you can gather more experiences from all around when you have this webinar or virtual setting, let's say. That's something that we didn't have or we couldn't attain before the pandemic. One thing that I don't like about webinars is when they are long. I believe that our attention span would just waver past 90 minutes or so. And we experienced some webinars that went on for 3 hours, and I don't believe you can stay put for 3 hours and just listen and take on all that information. Incorporating polls, questions, as well as Zoom rooms are really great. We try to couple or pair residents together, or resident with a mentor in a room, and they can ask them right away what they want or question that they have. That's really great. Also, another thing is that incorporating a lot of surgical videos, a lot of things that are really clinical in your presentation would attract the attention of the resident as well as any of the attendees. So keep it short or concise, try to be very interactive, and avoid self-promotion. We have seen a lot of self-promotion on those webinars where you just try to put on a really good webinar, and then the speaker doesn't really go into the point. They're talking a lot about themselves and stuff like that. And I believe that would just make you lose your audience and lose their attention. So, but I believe it's a positive thing. And I believe the hybrid concept is going to continue after the pandemic. So yeah, thank you very much.
Thank you,
so
Mayse.
much. Yeah. Apoorva, any comments from you?
Yeah, so wonderful answers, everybody. What's wonderful is that there's very little overlap between your perspectives. So it's each of you has so many fresh perspectives that makes every one of us think. So one thing I noticed about webinars was that there's this burst of creativity. So many people have had so many webinars about such diverse topics. It's almost as if you're thinking about what webinar to have next. So in that quest, I think there's a lot of creativity. There's a lot of allied topics to talk about, as in we've had webinars about finance management for ophthalmologists, something most ophthalmologists wouldn't have thought about. Some webinars are about honing talents and kind of renewing your hobbies in a more serious way. So I think there's also a burst of creativity in arranging webinars and finding newer topics to talk about, which probably we wouldn't have talked about otherwise if not for webinars. So great answers, everyone. So it's very heartening to see so many perspectives. So my next question is for Dr. Chai. She is she is the head of the Philippine network of young ophthalmologists, and she has her own private practice. I remember I met you last at the global session in the YOSI symposium. So welcome back, Chai. And I want to ask you how you've utilized social media, or have you utilized social media as a teaching tool for young ophthalmologists? Do you have any favorite handles, or you prefer any particular kind of social media to kind of disseminate knowledge or information about ophthalmology in general?
Hi, thank you, Apoorva. I would like to say hi to everyone here. It's so nice to see everyone. Well, with the pandemic, suddenly the world isn't so big anymore. So well, nothing can replace face-to-face meetings to social beings like us. So, but I think in the middle of the pandemic, social media has impacted our lives way beyond what we thought it would. It's been a silver lining, and it's been the most convenient way to connect with everyone. And it's also because strengthening connections with our trainees is important, and we can't really connect just by texting and just by calling. So social media is the closest method to face. So social media tools we have been using are, of course, Zoom, whose stocks have skyrocketed due to the pandemic. And then I do FaceTime with my residents. We do Viber, and then lately there's been Cisco WebEx, and of course Google Meet. Educational sites we've been recommending now that we didn't pay too much attention to pre-pandemic were YouTube, because there we can see a lot of videos, brilliant videos from YOSI, and then Instagram, the AAO website, of course, the Alcon Academy website. I have no financial interest, but it's very interesting to explore on that for those who don't know about it. And then lately, the AOPcongress.com, or the Advanced Ophthalmologic Practice website. So I hope you guys can check that out, because I've been recommending that lately. And I think I've been getting good feedback out of those. So there.
Okay, anything about the APO social media handles? So you've been pretty involved with that.
Yeah, for the PAO social media handles, because the Philippine Network of Young Ophthalmologists have just been established last year. For the educational platform, we have our Instagram. Please follow us. We have the Philippine Pinoy Ophthalmologists. We have that on Instagram. As for Facebook, it's a closed group, so it's just closed among the Filipino young ophthalmologists. And as for the YouTube channel, we have a YouTube channel, but it doesn't have much education on it. Because as for the educational platform, we have our mother society for that. So the Philippine Academy of Ophthalmology for that. So as for the young ophthalmologists, we basically focus on career building, because the academic part is being handled by our mother society already.
Thank you so much. And so next, I would like to know about any unique situation or solution related to the pandemic that you might have stumbled upon.
Just one thing.
Yeah.
Divakant, just one thing about YouTube I would like to add, that a lot of young ophthalmologists have started their own YouTube channels, and there's a mushrooming of YouTube channels, and all of them have been uploading their surgical videos and talking about various surgical situations, and they've got a lot of time on their hands to start like a full-fledged YouTube channel and kind of devote a lot of time to build it. So many of our young ophthalmologists are YouTube stars now, and I think will tell you about them, and you can subscribe to their channels. Very good content, very high quality content, very high quality videos. So YouTube is kind of seeing a surge of channels right now. Divakant?
Great. So next I invite Dr. Jubaida. She's a VR consultant at the East Avenue Medical Center and St. Luke's Medical Center in Quezon City, Philippines. And she's also the head of retina services at the Philippine Children's Medical Center. So have you faced any unique situation or solution related to the residency training and education during the pandemic, which you would like to talk about?
Yes, good afternoon, everyone. Thank you, Diva, Kant, and to YOSI for inviting me to this session. And I'd also like to thank Cake and Pie Expo for providing this venue for YO educators to just talk and share the best practices of ophthalmic education. As I told the others, it's just like young educators talking in the library and sharing experiences. So what I'd like to share with you is the virtual clinic. So recently, at our institution, we set up the virtual clinic. Mainly, this is for the medical interns and clerks because they need the virtual clinical exposure. Last year, we started, upon the start of the pandemic, we started immediately the e-learning curriculum for interns and clerks. However, we really found clinical exposure lacking because they were pulled out of the hospitals. So with a virtual clinic, it's very simple to set up. It's just a teaching scope, and then you have a phone adapter, and then you have the video conferencing platform. So through this, the students in the remote location will be able to see the findings on the slit lamp, the anterior segment, and the posterior segment. And then there's another device that will be hooked up to the video conferencing platform, wherein they'll be able to see the room view. So they'll be able to observe the history-taking interview with the patients. And then they'll be also able to appreciate the visual acuity examination, including the other 5-point ophthalmologic exam. So through this, it's like they are in the clinic, but they are located remotely where they are safe. And not only for interns and clerks, but this can also be utilized by the residents when they need to refer patients to their consultants in real time. So they will be able to show the anterior segment findings and the posterior segment findings in real time to their consultants. Another thing that I'd like to share with you is the use of quiz maker apps or platforms wherein we can set up asynchronous quizzes or tests for the residents. So the pandemic created a unique situation wherein the regular schedule of rotations in subspecialty clinics are disrupted. And so the clinic schedule, the conferences, the evaluation of students are all affected. And in our institution, some of our residents are even asked to man or cover in internal medicine wards where there are COVID cases. So they are not able to attend to the rotations in ophthalmology department. So what's the good thing about this asynchronous quizzes is that it's a formative evaluation. At the end of the quiz, when they submit the quiz, they'll be able to receive the feedback. They'll see the correct answers, the wrong answers. And then there's also a link for references that they can read. So even if they are in a rotation outside the center, the eye center, then they'll still be able to continue with their learning. And so this one way of making our curriculum pandemic proof. So that's for the training. And another thing for fellows that we instituted is the retina in-service examination. This is to make sure that the standard of education in the retina fellowship programs are kept at par with international standards. So we have this retina in-service exam once a year, which we instituted last year. So those are the things that I'd like to share with you, and I hope would also be helpful to the other YO educators.
Wonderful. Thank you so much for sharing with us, Jubaida. Next, we forgot to take Dr. Jeremy's view as well. So I would like to invite Dr. Jeremy Kwok for his views. He is an assistant professor at the University of Hong Kong and has special interests in eyelid orbital reconstructive surgery. So Dr. Jeremy, your views on the online platforms and the online mode of education that has picked up recently?
Thank you very much for the invitation, and thank you, Cake and Pie Expo, for inviting me and Hong Kong Young Ophthalmologists to share our year of COVID and our online training sessions. Basically, we also had a lot of webinars, and I think a lot of doctors here have shared, their good and bads. I feel that webinars are in generally a good thing during COVID situation. I think it does enhance active participation. And for those who are slightly more shy, they can go to individual presenters after the presentation to ask their questions. Or I think the chat box is actually quite a good place to type what you want to ask. And also for, as people have said, recordings are good, but you never know if people will go back to watch the recordings. But I think in general, if you have a webinar you really want to review, or you have forgotten some of the things that are said, you can go back maybe prior to a surgical session that you're going to go to. You can review, say, maybe a younger resident, the phaco steps or the ECCE steps, and how to, handle different surgical situations. Yeah, I think for us in Hong Kong, we had different webinars, and recently we had a retinal workshop that was a 2-day retinal workshop. We tried to liaise younger ophthalmologists for presentation, and then we have some very senior who has been in private practice for many years, some ophthalmologists. Probably my teachers come in and join our discussions, and it was I think it was a good way to connect the different age groups and also different seniorities within our locality. So we had a very good discussion where it was, I think panel discussions are a very good way of sharing instead of giving a one-sided lecture. Having conversations with different ophthalmologists of different experience and specialties is very good. And lastly, because in Hong Kong and like many other places, we have many different hospitals where training and resident rounds occur at different times. I think our resident benefited a lot from going to different hospitals webinars to have, I think, a lot more teaching than what I had when we did not have any webinars at all. So I think the resources are out there, and you can even pick your superstar to listen to. Sometimes we have invited speakers from Canada or from the States to come share with us. And I think in general, it has connected the world in a different way, even though we are separated physically. And I'm sure when the world opens up again, I think the friendships would have been strengthened in a way where it has been different before. And I think there are the good and the bads. And in general, I think we have adapted well. And lastly, I think it's very interesting because I think as the webinar has been going on for a while, initially there are a lot of technical difficulties in creating webinars. People were, doubtful into how Zoom works, and there wasn't really a good platform for people to get on to share their webinars. But now everyone's using Zoom and other webinars where everyone's so used to it, and everyone has been upgrading their gadgets. Everyone has mics and new headphones and everything. So it's interesting to see how the world has changed with the new onsets of a pandemic of webinars, and I think it's an interesting change. Thank you.
Wonderful points, Jeremy. So Apoorva, let's move on to the surgical training segment. So the academic training and the theoretical aspect has been beautifully covered by the Zoom and online platforms, but surgical training has really taken a hit. So Apoorva, let's start this segment. You are on mute, Apoorva.
Yeah. So coming to surgical training, my first question is to Dr. Hangda. How can one practice surgical skills when patients are less and there's probably less conversion of OPD patients to the surgical theater? What has been, I know you're a vitreoretinal surgeon, what has been your experience in vitreoretinal surgeries, especially from the training point of view?
Yeah, thank you. So I think surgical training is one part that our residents or fellows fear the most during the pandemic. So so it's very hard to replace the actual hands-on experience. But I think a lot of the fundamental ideas, fundamental concepts comes from learning and discussion, not from your own surgeries. So you'll never improve by doing a lot of surgery by yourself, but you will only improve by reading what others do and by discussion with the senior doctors. So I think this is a very good time that we go back and to review the fundamentals. So I have some specific recommendations for myself for the vitreoretinal surgeries. I think many of you might be familiar with the vitreoretinal surgery by Thomas Williamson. So that's a very nice introduction to the basics of vitreoretinal surgeries. As for cataract surgeries, personally, I gained a lot of experience from the Eye Atlas, which is from the group called the Eye Movies. So that's offers a very good video introductions to all the basic cataract surgical maneuvers. So these two are my which build up my fundamental concepts of the basic surgery. So I think this is a good time for all these residents to slowly and to learn how they can do better in the future. Another possible a form of learning is to seize your chance during the emergency surgeries. So even during the lockdowns, the emergency surgery still goes on, and the consultants, they will have a bit of more leisure time to let you try. So I think this is a very good chance for all those trainees. You can prepare beforehand, and when you show up in emergency surgeries, you can show that you're already very confident in managing these more serious conditions, and your senior doctors might let you to do more during these leisure times. In the past, maybe because of the OR schedule, because maybe you have to do all these surgeries in the midnight, they don't want to give you the chance to try this. But this is a good time. If you're active and if you're prepared, I think you can go, you have more experience in the emergency surgeries. And another thing you can try to do is that even there's no surgeries, you can do a research on all the surgical cases, or even a simple audit of all the, like say, for many hospitals, they have a RD register, and all these database. If you go and review it, you will find many interesting stuffs inside. So, for example, one of my my colleagues, she claimed that she had very rare cases of recurrent retinal detachment. So I questioned her, but she don't believe it. But we go back during the past 1 or 2 months, we review our database and found that her recurrence rate is similar to the other doctors, which is not as low as she expected. So I think this is a good time that you go back and review all your cases, and you'll find many interesting viewpoints from there. And the last thing I like to say is that if the lockdown continues to more than say 4 to 6 months, I think if you are in a fellowship stage, I highly recommend you that you should consider to extend your fellowship, because although this might sound very it's a very difficult decision, but compared to your whole career, this is only a very short time period. And the fellowship is very critical and very crucial for your whole career. So just don't think too much about it. Just extend, and you'll definitely learn a lot after the pandemics. So yeah, don't hurry and go to the next level, because you will not perform well if you don't have the actual hands-on experience. So these are my several opinions. Thank you.
Thank you, Dr. Honda. So in India, especially Divakant will agree with me, because of the lockdown, patients that are coming after the lockdown have more severe membranes. They have diabetic membranes, or even RDs are coming with a lot more PVR than pre-pandemic. So residents and not residents, fellows are getting lesser chances than usual, because this is a complicated case and the consultant would like to do it himself or herself. So is it similar in your place?
We haven't finished our first semi-lockdown, so it's hard to say. But from your experience and from the experience from other countries, I think we should expect that to happen. So we're fortunate that for the current fellows, they are finishing up they're at their final few months of their fellowship. But for the new fellows, I think they will have a very hard time to start up with. Yeah. But anyway, at the beginning, it's good to review more fundamental concepts. So don't hurry to do all the difficult cases. I think slowly you'll get your chance and get more experience, and you can go and deal with all these more complicated cases.
Okay. Dr. Mayse, your views?
Yeah, okay. Well, I agree 100% with what Dr. Hang Ta has just said. I'm going to talk about my personal experience because I just finished my board exams and I graduated residency just when the pandemic started. So I was alone in the clinic and I wanted to do as many surgeries as possible, and I'm still in my learning curve as well. So it has been frustrating at the beginning when you say, I had these plans, I would do this many cases, I would tackle this and that, then I had to step back. And I asked this question to Ike Ahmed. I had the privilege to interview him, and he said, take your time, review everything in non-clinical setting, like know your machine, know your patient, know every bit, make it your friend, so that when you go into the OR again, that will be just behind you. You wouldn't be, flustered in these things. So try to review the literature as much as possible. One more thing are surgical videos. Personally, I log in to cataractcoach.com like on daily basis because they do have real-time surgical videos. These are very important to watch real-time surgical videos, not the ones that are really quick and you'll be frustrated. They make it in like 10-15 minutes and I take like 45 minutes to do this, and because it's not. They do have hurdles in the OR, they do have pitfalls, but when it's really heavily edited, that video, you're not gonna see these things. So try to go and see live videos, unedited videos. Those are going to give you more, realistic expectation to what is going on, and also see videos that are sent from residents where they have gone wrong and how to actually, correct that. One more thing that is also good in the pandemic that people are actually, or mentors or more senior specialists have been offering their help a lot. Even if it is just theoretical, not in the OR. Like you say, I have this problem. They have more time to talk to you, to chat about your technique, about what you do, about how to overcome this in the future. Also know your patients more. It gives you more time to know the patients, to actually evaluate the patient better, and be patient with yourself. Taking more time is of paramount importance. Just keep on telling yourself, we're going to get there. We're going to do that. I'm going to do more surgeries in the future. I'm going to have more chances as well. But also remind yourself that you're going to have to work triple as hard when this all goes off, because you need to catch up a bit, let's say. But also, it's not that bad because you are going to be more prepared. You're going to have your base that is, really solid, and build up on that. And don't lose hope. Keep on a positive outlook to things. Our careers span most of our lives, and we're going to have time. It's not a contest with who did more surgeries or who's going to be the first, because being the first is a thing. You are the first just one time, then other people are going to catch up. It's about consistency in your practice at the end. So you build up consistency by being patient, I guess. So that's it. There are a lot of resources. A lot of people are going to help you, and be patient with yourself. Also, if you have a Wetlab or simulation, it's really important to practice on these things. You have access and privilege to these things. These are really, really of paramount importance in such times. Unfortunately, in Jordan, we don't have that, but I believe if your country offers these facilities, they're going to help you a lot in honing your skill. So yeah, that's pretty much it.
You're on mute, Apoorva.
Thank you, Mayse. Very good points. Excellent points. Divakant, next question shall we have?
Yeah. Yes. So Mayse talked about a wet lab. So next question is to Jeremy about a wet lab. So, how important it is in the present scenario and how we can enhance that experience.
I think for me, when I was resident training in like year 1 and 2, we had a wet lab. I think the facilities were not as good as they were now. In the past, we had like a retired phaco machine, and also like we suture on pig eyes, and we still use pig eyes nowadays because I think of the feel that is more real than maybe an artificial eye. But I think nowadays in Hong Kong, because our pandemic is not that out of control, so we still have some workshops that are for all the residents that are in our locality, in our city. So I think we, in the past, for lid surgery, have offered dissection of with sheep lamb heads, not cadaver heads, because we couldn't really get access to those. So we had some lamb heads for lid surgery and ortho surgery and dissection. And then for vitreoretinal surgery, I think there is a workshop that has a virtual, not a virtual, but like a 3D camera where people can use an artificial eye to train their their vitrectomies. And also for cataract, I think recently I tried to do the Yamane technique and I needed practice. So there's some artificial eyes where you can buy just specific to train the Yamane technique or the SFIOLs, which I think is very good. So all in all, I think wet labs is very important when you're trying like a new technique, especially when you're a resident, especially during maybe the COVID situation where real time practice is harder. In our locality, we have decreased our number of patients, so we haven't completely locked down the hospitals yet. And I think because the pandemic is improving in our place, so our number of cases are going back to normal in terms of our OPDs and our surgical practice. But I think wet labs are very helpful, and I think there are a lot of new technologies that can be useful, and can be used. And I think it's a good way to train if the pandemic is creating a problem for the training. Yeah. So thank you.
Right.
Yes, Apoorva, let's move on to the next.
Yeah. We'll move on to the next question. So, Dr. Ashraful, can you tell us your favorite online resources for enhancing surgical training? I know a lot of the previous speakers have already said, told us, but what are your top online resources?
Thank you. It's a valid question and a time-demanding question. But one thing I need to add with the other speakers that the previous and the recent pandemic, what we have, there is a must disadvantage of surgical training, hands-on training. That is the main disadvantage for the fellows, because before the pandemic in 2019, where my cataract and refractive fellows get 500 cases per year, but now it's 200 or 150 cases. It's very much frustrating for the fellows. That's the one point. But things that there is no difference between the online teaching and online learning before pandemic and in the pandemic, because what other speaker told that you must need to see the surgical steps from your seniors, from your mentors to enhance yourself, because doing surgery is one of the training, but seeing the surgery is another part of the training. So the question answer is that what's the what we have right now, the surgical training facilities which involves the online that we have previously. With that also, that our fellows and our trainees, they must have to attend some surgical steps which were described by our faculties. So sometimes they have to attend live in the OR, but sometimes we recorded the steps. That is the not edited part, the main nearly live step-by-step surgeries, and we need to discuss with the fellows that. And recently what we have incorporated that we have the Zoom and internet facilities with all our operation theater. So what we are doing, like that a senior faculty who cannot join in the OR, but a fellow is doing the surgery, he or she can supervise this surgery online from his chamber or by internet. This is a facilities we could incorporate it before the pandemic, but we incorporated it right now. And another thing is that the best thing for the pandemic, we get a little bit more time so that our faculties, this is the must regular time for the faculties that they will sit with the trainees online about the surgeries. Like I am the faculty of cataract and refractive. So this is my weekly routine to sit with my trainees, my fellows about all the steps, basic steps, theories and fundamentals of these surgeries and what they are doing to supervise and also see their surgeries. Maybe I cannot go to the hospital all 6 days, but this is with online, Zoom or other internet facilities, we are supervising and we are discussing with them. That is the thing that, yes, the fellows are not getting that much of surgeries, but their fundamental things and the steps they can learn by themselves. And one thing I must thanks to Dr. Honda that this was our views that definitely in this pandemic, when the 1-year fellowship or 18 months fellowship, if the fellows are not getting cases properly, only the knowing everything is not enough. You need to do at least some hands-on training and you need to complete every steps of the critical situation to be confident. So this is a good part I take on point that you can increase the duration of the fellowship if you think that the trainees cannot get the proper cases. Thank you.
Wonderful, Dr. Ashraful. That's a very unique solution you found about relaying your surgeries online to a senior consultant. That's a very good solution. So, Dr. Jubaida, have you stumbled upon any such solutions or unique situations during, especially pertaining to training and education?
Yeah, regarding what the others have already said, Dr. Ashraful and Dr. Jeremy, the silver lining really of the pandemic is that the consultants were able to slow down and really have time to discuss cases in depth. So I think the trainees, residents, and fellows should make the most of that time that the consultants are able to give them. They should also read on their own so that when the consultants are there, they will have a very very good discussion, not just a one-sided discussion. So they should be proactive in their learning. Second is that here in the Philippines, the Vitreoretina Society of the Philippines have a regular fellows forum. So as Dr. Ashraful said, a case that is discussed among a group of people, a lot of people learns from that case. So here, the case that is seen in one institution can be shared with the other institutions such that learning is multiplied and the others also learn from the case seen in supposedly in other institutions. But what I want to share is that about the Rover System e-mobile app. So we stumbled upon this because during the pandemic, there's a limit to the number of people that can be inside the operating room theater. So it's just the surgeon, which is the trainee or the fellows or the resident, and the assist, which is the consultant. And the other consultants have to be in a remote location to be able to see the real-time surgery. We need to have an app that would allow them to see the real-time surgery. So we have this Rover Systems e-mobile app. If you have a camera in your microscope, a digital video recorder, and you hook it up to the internet connection, you can view the video real time, or you can do a playback or download the video. So during the surgery, the consultants can discuss what is going on in the surgery. And also at the same time, if during a conference, maybe the videos can also be played so that the case can be discussed thoroughly. This can also be used for medical students because they learn from the didactic lectures. However, they appreciate when they see the surgeries itself. They are not right now during the pandemic. They're not allowed to be inside the operating room. So the surgical videos really help for them to grasp the better understanding of what we discuss in the lectures for medical interns and clerks. So that's what I wanted to share.
Thank you, Dr. Zubaida. I think your answer had many common things with Dr. Ashraful's answer as well. Please, could you leave the name of the app in the chat box? So, yeah. So my next question is for Dr. Sonal. This is a very important question. Did you notice any major gaps in knowledge or practice patterns amongst residents or fellows when there was some respite and they came back to the ward and the OR? Were there any major knowledge gaps or practice gaps?
Thank you, Apoorva,
Dr.
for this
Sonal.
really important question. So yes, so our setup was such that we were lucky enough to have a small satellite or peripheral hospital attached to the main medical college hospital for the eye department. That hospital, main hospital, was converted to a COVID center, and we were all forced to go in a way and work at the satellite center. And a lot of residents were working in the COVID, so they were for a very brief amount of time in the eye center, which was having much lesser resources in terms of the equipment as compared to the main center that was converted to a COVID center. So when they came back and the original building was sort of taken back by the eye department, that was also a very, very happy moment. We were going back to the whole parent hospital, and that time onwards, we as consultants were not feeling that different going back to the OR. I wouldn't say that it was not like a good experience to go back, but for the residents, I felt that yes, they had, even those who were first year residents and had just learned the the slit lamp viewing systems, and had just set their IPDs in the microscopes. They were all now having to relearn all those steps, and their hands were so hesitant in doing those simple procedures just after a gap of say 1 or 2 months. And it was a real relearning and hesitant phase for them initially for a few days. But yes, I also noticed that they had this renewed spark of interest and respect for the resources. Like earlier, we would tell them go and perform this OCT angiography and come back, and was like, okay, we have to do 10, we'll go and do. And now when they had been shifted to a hospital that did not have the OCT angiography but just had a basic OR setup, now when they were back, they had this renewed interest, and also sort of a ticking time bomb kind of an effect, that when will this all be taken away, and let's learn as much as possible, as quickly as possible. They were more aggressive towards the number of surgeries that they wanted, and I could see that yes, the interest was really renewed, and they were really grateful for the branch and the patients and whatever opportunities that they were getting. They were like sort of very much eager to much more eager to learn in the brief period that now they were getting, because we could all see that yeah, some more patients of COVID and something might come up very soon, and being in the medical college setup, they would also have to go back to their COVID duties pretty soon. So those period, yes, it did see, I could see that some of the skills were getting sort of diminished or shaky, or like a hesitancy had come in, but then it all started going back to normal. And we also ourselves on the teaching side, we tried our best to give them more number of cases and to sort of make up for the lost time. So it was a period in which yes, the offline classes also saw very much renewed interest, and during all sorts of other practical teaching also, I felt that the residents did have a really quick way of learning, because of their attitude, which was now having more of I should say gratitude and more of interest towards their branch. And it was like this was taken away from us for a while, and like let's maximize whatever time that we have. So that thing was something really appreciable, I felt, for me. So yes, there were things that were lost, and but when they came back for whatever brief period that it was a very, very good comeback, I should say. So thank you, Apoorva, for this question.
A renewed interest and more gratitude. So Dr. Chai, your views? Chai, you're muted.
Yes. Sorry. Well, you were asking about if there's like the major gaps in the knowledge and practice patterns, right? So among my residents, well, it has definitely been compromised, because I think the normal stresses of personal and professional lives have been compounded with the fears and anxieties of the pandemic. So I have seen an initial decline in their academic performance, and then I figured that the learning curves are much steeper with less face-to-face interactions and then less cases. And then, of course, there are less surgeries because we've been cutting back on surgeries. I expected more post-op complications, but surprisingly, maybe my residents are more vigilant in learning from every case. And maybe because they know that there are technically less patients to learn from. So I think they've been more vigilant in learning from what they have and making do with what they have, with the limited patients that they have. So it is impossible to predict when we will all be free to restart the routine care. But we keep on reminding our residents that despite COVID, they are still under training, and then they are still ophthalmologists, and there is so much there out there to learn. So as consultants, we are learning with them as well. But I am confident that everyone is getting the hang of things, and we are all thriving together every day. So even if I thought that it's compromised, their learning is compromised, I think my residents are handling it pretty well because it's like they're more conscious about, and they're respectful of what they have, of whatever it is they have left. So that's it.
Thank you, Chai. There was a lot of agreement with Dr. Sonal's answer as well. So my last question in this session is for Dr. Chee. How was your experience in COVID wards as an ophthalmologist?
Hi. So I was actually personally deployed to a screening facility to screen symptomatic patients for COVID-19, and we were seeing about 100 patients a day. Almost all of these patients actually had to receive nasal swabs for PCR, and about 90% of these swabs turned out to be positive for COVID. So at that time, there was actually a lot of anxiety and fear among us in terms of whether we will actually catch COVID-19 ourselves. But I guess our infectious control procedures were quite rigorous, and we were safe. And interestingly, at that time, none of these patients actually had any sort of eye symptoms. So later on, we were still interested to find out whether there were some subclinical signs that we could find on retinal imaging. So we were at a quarantine facility. We did a retinal imaging study, about 100 patients with COVID-19. And about 1 in 9 of them actually had some retinal microvascular signs, such as dot hemorrhages, cotton wool spots, or some even have vascular tortuosity. And these were patients with no history of cardiovascular disease. So we thought that this could be transient retinopathy from cardiovascular alterations or seen in COVID-19, or it could just be a manifestation of some form of systemic inflammation. In terms of perhaps indirectly how COVID-19 has impacted some of the incidents of disease that we see, would be that we actually saw a slight spike in the rates of endophthalmitis after intravitreal injections. And at the time, there were some reports also coming out of this increased incidence of endophthalmitis. And it was postulated that this was because patients were wearing face masks, and respiratory droplets were actually inadvertently directed towards the eyes during the intravitreal injection. So this led us to change our practice, whereby patients still had to wear masks, but we made sure to tape this mask down, make sure they were airtight to prevent any possibility of these respiratory drops from reaching the eye during intravitreal injections. So this was one of the interesting sort of increase in rates of infection in the eye that we saw during COVID-19 pandemic sometime last year. So far, I think we have got it quite well controlled now. Thank you.
Okay, thank you. As a continuation of that question, Dr. Jubaida, how was the triad system in your hospital for ophthalmic checkups, considering it's more of an elective specialty?
Well, first of all, it's really very important that for an institution to have safety officers So in our eye center, we have a group of safety officers composed of doctors, nurses, and the chief resident. The group of safety officers, they overlook the adherence to protocols, review the safety protocols, and they also oversee and coordinate the contact tracing so that there will be an immediate response when a case is identified. Second, the appointment system is very important. This will avoid crowding in waiting areas, and we can limit the number of patients coming in a particular time. Third is that we have a triage officer that interviews the patients coming in. They have a health declaration form to check the symptoms and the exposure of the patients and the caregivers that are going into the eye facility. Also, we have a red eye triaging system. So it is not very common to have conjunctivitis, but it's for patients with COVID, but it is a manifestation of COVID. So we have had several experiences with that. So we set up this red eye triaging system. So if a patient has red eye, they are immediately sent to the red eye triage, evaluated if the patient is at high risk for COVID infection, and they will be sent to the COVID emergency room right away. If not, they'll be sent, they're allowed to go into the facility and evaluated further. But the last thing is that we are very heavily relying on testing. So we use RT-PCR and antigen testing for patients that will undergo procedure, and also for patients that we think are at risk for COVID exposure, COVID infection. So those so far, we are able to control the COVID exposure and COVID infections in our eye institute, and we are able to keep our staff, the patients, safe, provide a safe environment for everybody.
Okay, thank you, Jubaida. Divakant?
Yes. So next, my question to Chee. Did you use an eye for a patient with the pandemic?
Oh my goodness. Yes. I lost an eye and a life during the pandemic. And then because during the first few weeks of the lockdown in March 2020, I was so scared to go out. So I canceled my clinics, and then I refused to hold face-to-face clinics. So I tried to push online consultations, but as a private practitioner, the private patients thought it was free. So, and then a lot were uncomfortable with it. So I finally decided to retrofit my clinic, put all the air purifiers and exhaust fans and vents. And then on my first clinic day, my patient with orbital lymphoma came with more extensive lymphoma, and then he had no vision anymore. So when I asked why didn't he call me or tell me about it, he said, because doctor, you didn't have clinic. So, and then I had a retinoblastoma kid with recurrent retinoblastoma who failed to undergo treatment. Again, when I asked why, they answered because of the lockdown. So, because there wasn't public transport. So since then, the words I didn't have clinic, and then lockdown kept on resonating in my head. So because of that, I vowed never to miss clinic again, despite periodic lockdowns, despite surges in COVID cases here in my country, because we have them every now and then. It's like a vicious cycle. So even if we have those, I don't miss my clinic anymore. But I think it's because I've retrofitted my clinic already. And I think a lot of doctors have done that because our parent society has given out recommendations to how to retrofit our clinics and to make it safer for everyone. There.
Such a difficult situation for physicians in general. Apoorva, the next question, please.
Yes. So, can you? I think Divakant, we've already had a social media question. I think we can skip that, isn't it?
This is in terms of utilizing social media for your practice.
Okay, Dr. Jeremy, your thoughts?
Maybe we can have a quick comment. Yeah.
Yes, Dr. Jeremy.
I think we've been using a lot of WhatsApp, since WhatsApp has been around, like for the residents, when they see a case or a CT that they've done, they want like secondary consultation for, say, a specific oculoplastic situation, then they would usually send through WhatsApp a video of, the CT scan or whatever they are struggling with to more senior ophthalmologists, and then we don't really have to return as much. Secondly, we, in terms of social media, is less so because I think there is more of a patient confidentiality. So usually we would not post anything on Facebook or WhatsApp. I mean Facebook or Instagram. But I think we have started, say, for some of our prison consultations, because in our practice, in our hospital, we do see some patients who are inmates in the prison. We're trying to set up a connection between the hospital system with and also with the inside prison clinic, so that we can see the notes, and whenever the patient needs an OCT or something, it can be seen within the prison and the patient doesn't have to come out. And also we try to do some telemedicine with new slit lamps and things within the prison, so that it's I think something new we're trying to test first. We haven't really done it with patients who we actively have in our hospital currently, but because of the prison consultations, we don't have to go in so frequently now, then those are things that we have adapted to with a COVID in mind, or also with some kind of limitations in breaking some barriers of going into prison, etc. So this is some things we have changed. Yeah, apart from that, I think for consultation, usually it's just through WhatsApp to try to for help, kind of thing.
Okay. Right, Devakant?
Yeah. So next question is for Dr. Ashraful. So this is in terms of somebody having a private practice or having his own setup. So it has really affected people who have started out fresh, and I think all the practices have had a great impact due to this. So do you have any tips on how to come out of this situation and come out stronger?
Yeah, thank you, Dr. Devakant, because in this COVID situation, we all face this, though who are doing the private practice. So I can share my stories. That one thing is that you have private chamber only, and second thing is you own the hospital. The second impact is very big when you have the hospital like us. We do the group practice and we have 9 branches. And when the COVID pandemic started, it really impacted us because we closed our hospital for 15 days, and 15 days for 9 hospitals, it's a huge financial thing. But one thing is that you need to make some structures. That what is the thing? In this time, when people are afraid to go out to come to the hospital, you need to email, you need to communicate with your old patients who had get service from you previous days, that yes, what service are now we are offering, that you can come when you need to our hospital. We are safe, we are maintaining all the precautions, everything we are maintaining, that we need to encourage and make them feel safe to come to the hospital. And again, we need to spread the things to the local community that yes, this hospital is open, because in this pandemic, what happened in lockdown, all time is not emergency, and when the chamber practice is going, all not doctors are sitting in the chamber. But you need to spread the news in the local community that yes, your hospital, your chamber is open. That is one tip. And second tip is that when it's come to the hospital, you need to make sure that your major stakeholders, your major surgeons, like who has bulk of patients, they must need to do the chamber. It's very tough, but you make to come to a situation that they continue their chamber. I was affected in COVID 2 times, but I could not stop my chamber. Similarly, the other practitioners and definitely the surgery, you cannot stop the surgery. Surgery facilities must have to continue with all the precaution, because the surgery is the main revenue for the hospital. So for who are doing the private practice, the thing is that good service and definitely awareness among the patients that you are giving the service, and patient has the faith that yes, they can get the best service when they come to you. That is the main tips to recover from this situation. Thank you.
Fantastic points, Dr. Ashraful. Dr. Devakant, would you like to ask the next question?
So my next question is Chee. So how has been yours during the lockdown, the pandemic? How have you been able to utilize this time?
Hi. Okay, so with regards to research, I think it was a double-edged sword, because if you already had the data and you're just writing up, definitely that gave you a lot of time for you to uh, finish a manuscript and get it published. But if you are still recruiting patients, still gathering data, then basically that aspect grinded to a halt during the lockdown. Now it's better now. We are getting more patients, but during those times, patients were not keen to sign up for studies. They didn't want to spend extra time in the hospitals, basically worried about infection. So, with regards specifically to COVID-related literature, just now I mentioned that we did a study which we were able to very quickly carry out in a quarantine facility, describing the retinal signs in COVID-19 patients. And I think that experience taught me that the key to conducting COVID research or any future research that involves a disease outbreak, is really that you will need quite to closely coordinate with infectious disease experts as well as the ground staff, so that you can ensure safety of your study team members, make sure that you have proper transfer and handover equipment so that infectious disease protocols can be closely adhered to. Image acquisition had to be fast to minimize patient contact, and data should be uploaded to the cloud to avoid unnecessary transfer and potential contamination of hard copy data files. And we also explored the use of e-consent, so we don't use physical consent forms. And I think ideally in a disease outbreak situation, this should be done on electronic forms. If you are interested, you can look at our study, which has been published in the British Journal of Ophthalmology. The other COVID-related studies, I think, of interest is that we got together some YOs from the region to complete a survey on how the pandemic has impacted their training. And basically, the survey has confirmed what we fear, that training has indeed been quite severely impacted. And this manuscript is still under review, but I hope that it will be published soon. I think a few of us here are co-authors on this paper, so thank you so much for helping to gather the responses from your YOs. Thank you.
That's very interesting, Dr. Chee. The last question is to Hangda and Mayse. So, Hangda, did you renew anything in your personal repertoire of hobbies or talents? Were you able to devote more time to your personal kind of hobbies?
Yes, definitely. So you see, I'm an outdoor person. So my previous exercise focus on for marathons and triathlons, mountain climbing, these sort of stuff. So it never occurred to me that I will be doing yoga in my house. So so during the past few months, I have taken up many online yoga courses, and I found it to be extremely helpful. So it not only just train your core muscles, but it also calm down your mind, and it also improve your posture. So after practicing yoga, so I'm more aware of my daily posture, and I have paid more attention to my posture during the surgery. So if you take a walk around the operation room, you'll find most of the ophthalmologists, their posture during the surgery is very bad. It's bad for your neck, bad for your back, and bad for your thighs. So after practicing yoga, I think I adjust all my postures during clinics and operations, and I have less stress neck and muscle aches from in a daily basis. So I think it's very helpful, and there are many good applications online. So you can just use your phone and do yoga at any time at your own house. And yeah, so I think this is a very good exercise for the COVID pandemic era. Yeah.
Thank you. I think yoga is one favorite activity for a lot of people during the pandemic. Mayse, what are your thoughts?
Well, I believe during the pandemic, all we wanted to do is just try to keep ourselves centered and sane, and try to find a bit of serenity amidst all the chaos that was going on. So I found myself also reading more, catching up on my fictional reading, other than ophthalmic reading, as well as exercising. I found out that I really like to do a lot of deadlifts, so I've been increasing my weights. And one more thing, that I turned our basement at home to a painting room, and I started painting. I'm not that good at it, but it just gives you some catharsis and keeps you centered and takes your mind off stuff. When you try to learn about
painting behind you, is that yours?
Yeah, that's me.
Show us.
Yeah, it's not that great, but yeah, whatever. Just
show us. Come
colors.
on.
Yeah. So that's pretty much it. Just try to learn something that takes your mind off stuff. And I believe that's a redundant answer that everybody is trying to do, to keep ourselves centered and sane and take our minds off stuff. So yeah, and having time is good sometimes. So yeah, that's what I probably did most of the time.
That's great.
Wonderful.
That's great.
So the organizers have found our session really interactive and interesting. So they have given us a couple of minutes more to interact. So any more comments from anybody? It's an open house. Anybody wants to give a comment before we close the session?
I think I step in. I've been kind of listening to everybody. That's what I told Devakant. I said, I'm not going to speak much. We just want to hear from everybody what's happening. And Sonal's given our points of view from the India perspective. But I think, all of us are kind of going through a very similar situation in what we are looking at. We'll learn a lot from each other's experiences. I think, like we were discussing yoga at the end, yoga is definitely something that's helped me a lot in most of my, busy schedules. I can imagine I'd be having all kinds of issues of cervical spondylosis and this and that if it were not for yoga. So definitely that's something I recommend everybody do. And, more so, we're all adapting to this new normal and, very, probably, now our pace of adaptation is a lot higher. So we should support each other. And I think we're doing a good job there, all of us. And it's great to hear from all of you.
Any last comments, Dr. Sonal, before we close the session?
Well, I think it was a very healthy and interesting discussion, and it was extremely heartening, I should say, to hear from people across the globe having similar experiences. Maybe, as Chee pointed out, that even she felt that some of her residents were, having a renewed or greater respect for the human material that they are learning on, and the variety of experiences that people have shared in terms of their own refocus towards their personal goals and life in general. And the stresses that have affected all of us, and yet sort of brought us together on this online platform. All these discussions have brought us closer despite being far apart from us. This has been something as a shared experience, learning that everybody has been feeling the same thing. It sort of builds your kinship in a way. It binds you despite being so far apart from each other. I think some of you might agree. Any comments from Jubaida or Jeremy?
So I think, you go ahead, Jeremy.
Oh no, thank you. I just want to thank everyone. It's great to hear about everyone's year of webinars, COVID, and their contribution to their society. So thank you for having this and knowing that exercise is great. And yeah, I've been doing a little bit of sailing in my locality because there's a bit of ocean and it's pretty interesting.
That's great.
Thank you.
Yeah, so I think to follow that up, I think the pandemic is the great equalizer. So even if you come from a first world country or a third world country, developing country like the Philippines, we go through the same challenges. And I think those commonalities bring us closer, and this venue, like opportunities to be together, help us to share, to learn from each other, and so move forward beyond the pandemic. So hopefully the pandemic will end soon, but in the meantime, let's all go through it together so that we'll be stronger. Thank you.
Yeah.
Dr. Ashraful, your last comments. We'll take comments, last comments from everyone.
Yeah, thank you. Thank you, Dr. Divakant. Thank you, Dr. Digvijay and YOSI friends. It's an excellent session. So we got lots of take-home points, and hopefully we will utilize some points to our home also. And definitely we are looking forward to end the pandemic and meet with all. But till then, online is the best resource, and we will continue that. Thank you very much.
So the interesting thing is that apart from Chee, I don't think I have met any of you personally, but still all of you, everybody is so familiar. So that's how the pandemic has brought all of us closer. So Chee, your comments?
Yeah, I think, well, thank you again for inviting me. And I've heard so many interesting viewpoints from everyone today. I think these conversations are very important, and they'll definitely help us to emerge from this pandemic even stronger than before. That's what I hope for the future of ophthalmology. Thank you.
Mayse, anything? Last comments?
So I just want to thank you all for this. I want to thank Divakant for being a really power horse in all these times for young ophthalmologists. When we started Yojo, they were so generous, YOSI, to give us teaching sessions, and they're always including people from all over the world. And I believe the power of giving is really great, and we have to adapt that. And try to be open. And that's what the pandemic has also taught us, to be open to chances, to seize the opportunities and not just to wait it out, because waiting it out doesn't work. We have to work within the pandemic as much as possible. And yeah, sometimes make the best of it. Sometimes just wait a bit and things are going to be better at the end. So thank you very much. And I hope everybody would have a good day today for the rest of their day. We're starting here in Jordan. So, and see you all in person soon, probably.
Who else is left? Chee?
Yeah, thank you so much for this opportunity. You know, the challenges of the pandemic, it's so easy to get lost in the noise of the challenges of this pandemic. And, you know, having this group and your leadership, inspiring each other to just keep on making it better for everyone. It's very centering. So thank you so much for this opportunity. I really hope we can see each other soon.
And last, Honda. Yeah.
So one thing, can I just say one thing, Divakant?
Sure.
Oh, thank you. So sorry for the interruption. So we should have a good clap for Dr. Divakant and YOSI before this ending of this session, because the one thing is that the COVID is pandemic, and I think Dr. Divakant and YOSI, they are the pandemic for the young ophthalmologists. So that's the good part. They are to opposite, and the good part for them, the young ophthalmologists, the grown up in the pandemically, they took the leadership and the great part. So it's a very thank you.
It's a good time to acknowledge the team effort and the leadership that we have in the form of Dr. Digvijay, Dr. Apoorva, and our next president, Dr. Sonal. So hopefully greater times ahead in front of us. And Dr. Honda, your last comments, and then Apoorva, we can close the session.
Yes. Yeah, I totally agree with Divakant. The only person I've met in person is Chee, but yet everyone seems so familiar. So thank you all for the great discussion, and thank you for hosting this nice, excellent event. Thank you all.
Yeah.
So Digvijay sir, do we have? Digvijay sir, you have to unmute yourself, sir.
Yes. Am I audible? Yes, I said so. A special thanks to you, Divakant and Apoorva, for moderating the session so beautifully, so seamlessly. It was absolutely nice. It was mesmerizing to listen one thought and another, and it was amazing. And thanks to all the panelists and all the attendees who are attending this session, to Cake and Pie Expo, the Media Mayse, the organizers, for giving us this opportunity. We'll I hope we continue to work together in the future, all the young ophthalmology societies, all of us as leaders, as friends, and we make this grow further, our network. And again, a special thanks to Devakant and Apoorva for putting this together.
Wonderful. Apoorva, your comments, and then we'll have a good group photograph and we'll close the session.
No, I mean, no final comments really. I just think we all had a great time spending more time with our families. I know Devakant had a baby recently. I have a toddler now, 18 months old. And I think Chee is a mother to 2 toddlers herself, she told us last time. So I think we got a lot of time to kind of spend with our children, which we wouldn't have if we were working full time. So yeah. That's it. Let's have a group photo.
It is really appreciable that despite these toddlers, Devakant, and you have done such a phenomenal job at making this session and other sessions a great success.
Let's have a group photo.
Let's have a group photo. Very good. Okay.
Just a second. Is anybody taking it? No. So I'm unable to do it from my end. So if somebody
I'll do it.
We'll take it and share in the group.
Oh, that will be perfect. Thank you.
1 second.
Perfect. Thank you all. Thank you so much.
Thank you very much. It was a pleasure having you all at our show, and the recording will be available 48 hours after the show.
Thank you.
Take
Thank you
care,
so much.
Thank you.
Take care.
Bye, everyone.
Bye-bye.
Bye-bye.